I'd like to introduce our next speaker, Daryl Stevenson. He's an ergonomist from our newest ergonomist, actually, at OCal, from our Hamilton clinic. So he's going to be talking to us about concussions in the workplace. So, Daryl?
Thanks, Trevor. Turn this up a little bit. So my name is Daryl Stevenson, and I finished my PhD last year at Western University. And since then, I've been working at OCal as an ergonomist. And I'd like to talk today about concussions, not just in sports, but in the workplace mainly, and what we can do about them. So the outline today, I'm going to be going over what is a concussion, what are some of the signs and symptoms, what are the long-term effects of concussions, what are some of the workplace factors that can cause concussions, what can be done to protect against them, what are some of the return to work procedures and recovery procedures, and talk a little bit about our concussion symptoms underreported. And that was part of what I did for my PhD project. Before my PhD, I played for 6 years in the CFL, and I had 2 concussions myself, and I went through that process. And what's interesting about talking about them today here is that, like when I had them, it was my occupation back then. And for everyone out there today in the work field, it's their occupation as well. And there's a lot of crossover when it comes to that. And I specifically looked at the reasons that the CFL players were underreporting their concussions. So what is a concussion? Well, the 5th consensus statement on concussion in sport describes concussion as a traumatic brain injury induced by biomechanical forces. It's a result of physical trauma to the brain, and it causes an altered cognitive function. This trauma leads to a complex pathophysiological process that can result in a variety of symptoms and can be different for different individuals. So there's a lot of ambiguity in the definition of concussions and post-concussion symptoms. So you'll hear a lot of different terms being used for concussion, such as mild traumatic brain injury, mild head injury, brain injury, cerebral concussion. They get used interchangeably a lot. So throughout this presentation, I'll always be referring to concussion whenever I say any of these terms, and that's how people should try to think about it as well. There also is a lot of slang expressions used, and mainly in sports, this is very common, such as being dinged, being dazed, having your bell rung. So it's important to hone in on the definition and know that we're always talking about concussion and treating it seriously like that, and not using these slang terms to represent it. So again, concussions are very confusing as they can show up in a lot of different ways. There's a lot of different symptoms that you have to look for, and it's not very straightforward when it comes to the diagnosis, the recovery, and what you need to look for. So this picture just kind of highlights all the different ways you can look at it from different angles depending on what you're looking at. So I'll go over some defining features of concussions. And the overall goal of this presentation, again, is to increase the awareness. If everybody's awareness increases about concussions, it helps everyone, not just doctors and people dealing with the recovery, but workers can help each other, and they can recognize symptoms in each other. And that's how we're going to try and tackle this problem of concussions. So it can be either caused by a direct blow to the head, face, neck, or elsewhere to the body, and an impulsive force can be transmitted to the head. And this is often something that's misunderstood. The awareness of it is going up, but you can be in a motor vehicle accident and never actually hit your head, but you can still get a concussion. So it's important for you to know that it's just not something that hits your head. It's important in sports that people, if you're getting tackled and your head doesn't get hit, you can still have a concussion. So it's important to know that. So typically the results in rapid onset of short-lived impairment and neurological function that resolves spontaneously. So again, there's no cut and paste easy timeline for recovery. It's very much spontaneously you recover. So it's very much that you got to kind of wait and see what you have and play it as it goes. So in some cases, the signs and symptoms are delayed and will evolve over a number of minutes to hours. And actually, my second concussion that I had playing football, I didn't notice signs till the next day. I started to have headaches, and that's when they said, okay, you need to go back on the protocol. So it's very easy to kind of go back to work or to kind of go back in the game and think, I feel okay. But really, you need to evaluate that concussion event that happened and could this have delayed symptoms? So other defining features, brain function is what's thought to be affected, if only temporarily, by concussion. It doesn't have to be a severe concussion to affect brain function, and even mild head trauma has been shown to produce neural damage. It also does not have to involve a loss of consciousness. And people I've talked to said, I got hit, but I didn't get knocked out, so it wasn't a concussion. Well, it could still be a concussion. You do not have to lose consciousness for it to be a concussion. So it may result in neuropathological changes, but the acute clinical signs and symptoms reflect a functional disturbance rather than a structural injury. As such, no abnormality is seen on standard structural neuroimaging studies. So it's very difficult sometimes to prove that you have a concussion. You have these problems with your brain function, but they don't show up on results. And that's sometimes difficult for people to deal with. There's very common features of a concussion. The next slide that I have will have a huge list, I won't read them all, of different signs and symptoms to look for. They deal with cognition, so things like memory, judgment, communication, your movement ability, your coordination, your strength, your sensory, your vision, hearing, tactile, and social relationships can even be affected. So here's a lot of the symptoms, and this list keep getting updated, and it's just to try to encompass every possible thing that can happen. Your brain is in charge of so many things that, whenever damage happens, it can show up in a variety of ways. So things like headaches, dizziness, feeling dazed, nausea, poor concentration, even just a lack of mental energy is one of the signs and symptoms. Okay, because the duration, symptoms, the diagnosis, testing, and the treatment in each case are so varied, concussions can be very complex and costly to treat. And it's very hard to predict. If this concussion event looks like this, it doesn't mean that the end result can be predicted. It's very hard to tell what the outcome is going to be, and it's very individualized and depends on a lot of different factors that are a lot of unknowns right now. Typically, you will recover within days to months. The majority of individuals, about 73 to 88%, who experience MTBI are able to return to their principal occupation within the year of the injury. Depending on the severity of the trauma, concussions can have actually a very prolonged recovery, and we've seen that in a number of cases. Sports has shown us and given us a great awareness of this. People like Sidney Crosby, it's been highlighted so much in the media that people are becoming more aware and how long-term these can actually be. And this is due to microscopic physiological changes that occur post-concussion that can have delayed injury implications. So just like in my case, things can be delayed. So concussion recovery is a process that can show persistent symptoms up to 12 months or over 12 months. I was just talking to somebody today that said they knew somebody that had 16 months and they're still having symptoms. So early physiological symptoms such as headaches can turn into psychopathological issues such as anxiety, hypersensitivity, and depression. And those things can feed back and make other matters worse as well. So though a consensus has not been reached on the cause of long-term post-concussion symptoms, it is likely that biological, physiological, psychological, and social elements all play a role in symptom persistence. And suffering from these post-concussion symptoms for an extended time may delay an individual's return to work, adversely affect one's quality of life. It can have economic costs, especially if you're somebody that owns your own business and you're not able to work. And it can really damage your social life as well, as it can cause so many problems. So post-concussion syndrome, when you have symptoms post-concussion and they have evolved, so most mild traumatic brain injuries or mild concussion resolve within hours or days. However, up to 80% of people who experience moderate to severe concussion symptoms may develop post-concussion syndrome. And this syndrome can involve a cluster of symptoms: headaches, vertigo, cognitive delay, sensitivity to light and sound. I knew for me it was very hard. Whenever I'd hear stalls close, it was very loud for me. And again, it's very individualized on what you're going to be dealing with. These post-concussion syndromes following unconsciousness or something considered severe usually last up to more than 3 months. Okay, some factors that can contribute that they found to persisting post-concussion symptoms is medication-induced fatigue, headache of migrainous or cervical origin, vertigo, deteriorated sleep hygiene, if you're using alcohol or any other drugs, and things like depression can also factor into here. Okay, so these can be very hard to prove to employers or insurers. Like I said, you can have these symptoms day to day for months, and nothing is showing up on the CT scan, nothing's showing up on the MRI, yet you're still unable to attend to work. And that's when issues arise. You start to feel like, what are people thinking of this? Definitely in sports, there's a lot of pressures to come back to play, and definitely at work as well. So it impacts your memory, your mood, your function, and it's difficult to prove without any pretests. And even if you're taking these pretests about your baseline levels of concussions, these can be inaccurate or gamed as well. I've even heard of players talking about scoring low on them so that if they ever have a concussion, they would show that they didn't have one as much, just to underreport it even more. So it's hard for employers to understand how a concussed worker is actually feeling, and they feel kind of isolated a lot of times, especially if they're not able to return to their regular work. And there's no visible signs. It's not like breaking your leg or other injuries. You can go there and it's very much invisible, it's within you, and people have to trust that you're having these symptoms. Okay, and then also you can return to work, and once you start getting back to your regular work, these symptoms can return without any concussion event happening. So that's why it's a very gradual process, especially in sports. They walk you through week after week, slowly getting back into it, because they know, if you go and try too hard, if you even watch a video, do something like that, symptoms can come back. You start off very, very slowly, very gradually, and work your way back so that no symptoms are going once you're full back at work. There's other future concerns associated with concussions and repetitive brain trauma, such as Alzheimer's like dementia, Parkinsonism, motor neuron disease, including ALS. So there is future complications that can arise, and that's why it's important to deal with the symptoms right away and get on a good recovery plan. So there is something that's called second impact syndrome, and second impact syndrome is caused when a concussion-like event happens to someone who's already undergone a previous concussion and still having symptoms. So if you have an event at work, maybe you get in a motor vehicle accident or something falls and hits your head, and you have a slight headache and you think, I can work through this, I can deal with this. Well, if something else happens to you, it's going to be that much worse. So it's very important to monitor this and to take every caution necessary. So working after a sustaining concussion can be very risky, and the brain is more susceptible now to a second injury. The second impact can lead to even worse symptoms, further brain damage, and has even caused death in sports. So a caution is after reported concussion is extremely important for this reason. If anyone says they feel that they've had a concussion, it's very important to remove them from the workplace. So chronic traumatic encephalopathy, hopefully I said that right, is another thing that's very big in the media today, especially in sports. And it's a neurodegenerative condition, and it's thought to result from repetitive blows to the head that accumulate over time with repetitive impacts or concussion-like events. And this can show up many years later and cause many complications later in life. There's one idea going around that it's caused by tau proteins. We don't have to get into this too much, but they wrap around your brain cells and cause nerve cells to die. But there's many other biomarkers getting studied, but it's a very hotly researched topic right now. It mostly started off in boxing and when they started noticing it, but now they're seeing it in other sports, such as football and hockey and professional wrestlers. In a study in 2005 with retired NFL players, they showed that there was earlier onsets of Alzheimer's disease. There was players with 3 or more concussions were 5 times as likely to report mild cognitive impairment. There was a 3-fold prevalence of memory problems as compared to players who retired without any previous history of concussions. And there's abnormalities in these neuroimaging studies that show differences disproportionate to their age group. Okay, so why include concussions on RSI Day? Well, it may not be the same as a traditional RSI, but if you repetitively impact your brain, it can result in an injury just the same. The long-term effects may be worse than traditional RSIs, and you are less likely to fully recover from a brain injury than a muscular one. Concussions, compared with other injuries, also often involve a loss of time at work. In 2016, 78% of concussion claims involved a loss of time from work, compared with 15% from non-concussion claims. So concussions in Ontario workers. In Ontario, 7.3% of all traumatic brain injuries are work-related. According to the Workplace Safety and Insurance Board, there are 1,644 claims requiring time off work for concussions in Ontario in 2012, up from 790 in 1996. There's a large incoming wave of concussion problems, and it's already started, and we are short on frontline help. Due to the awareness of concussions through sports and through the media today, people are becoming more aware of it, and more claims are coming out. Okay, but that's a good thing, because people are becoming more aware that they are getting these concussions. So upon examining workers' compensation board reports, it was also found that there was an increased trend in concussion cases that are being reported. In 2013 in Ontario, 80% of traumatic brain injuries filed to the Workplace Safety and Insurance Board were for concussions, versus 50% in 2010. So just in those 3 years, 30% jump. Statistics reveal that the number of time loss claims for work-related concussions increased by 371% in Ontario from 2004 to 2013. 65% of Ontario occupational concussions in 1998 were experienced by males. However, I'd like to point out that in many sports studies with females, there's actually more reported concussions in similar sports by females. So I don't think it's a huge difference. Anybody can be affected by concussions, and I think everybody needs the awareness. According to the Public Health Agency of Canada, traumatic brain injuries will be the most prevalent neurological condition by 2031. And as these numbers increase, so do the claims. So what causes concussions in the workplace and in general? Depending on the population, the most likely event to cause concussions are vehicle accidents, falls, sports, recreational activities, and assaults. And as you can see by concussions by age group here, definitely children are affected and elderly the most. So who is at risk? Well, at the workplace in Canada, the highest rates of workplace concussions are in the industries of transportation, storage, government and primary industries such as forestry, fishing, and mining. And in these jobs, the most common cause of workplace brain injuries overall are from slips, trips, and falls. Those things can be definitely prevented most of the time, and being struck by an object or a falling box is also another cause. Motor vehicle collisions is a big one. And in some cases, students, customers, patients, or coworkers might actually strike an employee and cause a concussion as well. The main causes, though, are very individualized by the industry or the occupation. So some ways that we can try to prevent these concussions in the workplace are removing tripping hazards, making sure that walkways and workspaces are free of clutter, or that anything else that can cause a slip, trip, or a fall. Use proper signage whenever to alert employees of wet surfaces or poor walking conditions. Keep shelves, storage, and areas in your workspace clean and organized to avoid falling objects. So in a warehouse or storage facility, you want to place the heaviest items lowest to the floor, if possible, to prevent causing them to fall on the employees. You also want to wear proper footwear to prevent falls in slippery, icy, or other types of rugged terrain. Some other tips are to not stand on chairs, desks, or tables, but rather use an appropriate step stool or access platform, or a ladder to avoid falls. You want to avoid working from heights and know how to use fall protection or fall restraint equipment if you need to. If a job requires a hard hat, make sure it's appropriately fitted and in good condition. However, it's important to know that helmets are not going to completely prevent concussions. As we can see in sports, everyone's wearing the fanciest helmets, and it's still a very common thing to happen. So helmets help, and they reduce a lot of the physical damage, but they won't always prevent a concussion. And it's important to report all unsafe conditions to the nearest supervisor. Use handrails also while taking the stairs. So if a worker has concussion symptoms, or if you've seen a concussion-like event happen, you immediately want to alert a supervisor. You want to report the incident immediately. It's important to know this has happened, and because of things like delayed symptoms, it's important to report any incident that happens. You want to seek medical help, and do not try to diagnose yourself. If you want to, it's very, very common in sports. Players will sit back and they'll diagnose themselves, and a lot of times they'll use strategies that they used when they were younger, such as trying to remember the time, going through what day it is, where they are, things like that. But as you've seen from so many symptoms and so many different things that can happen, it's very hard to diagnose all that and to know. So it's very important to seek medical help and consult a healthcare professional to help with the diagnosis. Also, if you have just had a concussion, you're not in a very good state to assess yourself as well. So you also do not want to be left alone. You don't want to drive home after work after having a concussion. Very much have somebody with you, have a buddy system, have somebody drive you home. In sports, a lot of times they'll have somebody stay with somebody the entire night just to make sure they're sleeping okay and everything like that. They'll wake them up once in a while just to make sure everything's okay. So it's important to have somebody around you for that purposes. I was also involved at Western in a research group talking about nutrition for concussions and specifically for children. But we found that it's very important to get people nutrition right away. A lot of times, especially if you have symptoms such as feeling nausea, people don't want to have anything to eat or drink as soon as they have a concussion because they don't feel well. But it's very important to have those nutrients in you, especially for your recovery. Okay, you want to seek a doctor immediately if you start feeling more confused, if your headache is getting worse, if you start vomiting, if people are having problems waking up, again with the buddy system, if they're not waking up properly, if you have any trouble walking or having a seizure, or any strange behavior that starts to come. So there are risks if an employee returns to work too early after the incident. So even with good intentions, you may be unintentionally pushing the worker to activities that may be too demanding or stressful from a cognitive perspective. The employee may be leaving very exhausted and may be forgetting things or doing things without their required mental capacity. So it's not good enough that somebody just got through their day and okay, they worked 8 hours, they're okay. Well, maybe they are not okay, and maybe you're pushing them too hard. So it's very important to keep monitoring these things. So in a group of workers in the UK, in a research study, who had sustained mild to moderate TBIs, reported that some important issues they faced were the invisibility of the injury, which I discussed, continuing symptoms affecting their ability to do their jobs, a lack of advice or guidance when returning to work with a concussion, and in addition, the return to work support systems were considered poorly coordinated and managed. Okay, so some factors that they found that were associated with poor functional outcomes were having dizziness, the number of symptoms reported, any post-traumatic stress, cognitive impairments, reduced social interaction. People feel that they're isolated after concussions, especially if they get their roles reduced. If they're financial compensation seeking, loss of consciousness has been a big factor, and any pre-existing mental health difficulties. Okay, there are very limited treatment options at this time. And traditionally, in the past number of years, and certainly when I went through my concussion problems, it just meant rest. You basically were isolated, go home, stay in a dark room, don't use your brain. don't use any devices, anything like that, and just kind of wait it out and see and wait, keep resting, keep getting better that way. They are changing and different treatment options are coming out, but it's an ongoing basis. Ongoing treatment options are being researched, and there's no best practice yet for those who did not experience spontaneous recovery. So some general tips do exist, though, for concussion recovery. So resting and getting an appropriate amount of sleep is very important. Not using alcohol or recreational drugs. Not taking sleeping pills, sedatives, or any other medications not prescribed by a doctor. Not playing sports or anything else that's going to cause another concussion-like event. And checking with your driver when you can, or your doctor when you can return to things like driving, biking, and operating heavy machinery. And then getting back to your normal activities very gradually and slowly, and again, and not trying to tax yourself too much. Okay? But definitely, whenever you have any concussion-like symptoms, your recovery should be guided by a doctor. And these are just some general tips to think about, but definitely you want to be under surveillance of a doctor when going through this. So some other considerations. That rehabilitation therapy may be key during the recovery. So you may be going through speech therapy, occupational therapy, physical therapy, or a combination of the three. You have to realize that things like thinking, speech, and reaction times might be slowed, and it may be harder to concentrate, and especially for long periods of time. And you may not be as productive as you used to be. And so these are just things to expect during that recovery phase. So incrementally over time, though, the employee should be able to return to normal work. So ways to accommodate for a worker who has previously had a concussion. So it's very important to respect any work restrictions, especially coming from a doctor. You want to reduce the physical and cognitive exertion. Reducing the work during the initial stage of healing may help the employee's recovery as well, or just letting them completely be off work. A doctor may recommend that the employee avoid driving, heavy lifting, and you want to be able to provide a calm and quiet workplace where the lighting can be lowered if needed, the noise can be reduced, and you want to ensure that, again, with the driving, if they're commuting to work, that you want to take care of that and make sure they're not always doing that themselves if they are going through problems. So it should, again, be a very gradual process when returning to work. If you're doing a physical job, maybe you get to get put on desk work and see how long you can do that, how many hours a day you can get through that. And you want to keep gradually increasing the amount of hours throughout each work day and week. You also want to be positive with these people. Anyone going through a concussion, it's very important to take the condition very seriously, but it's also very important to be positive about the outcomes and reassuring them about their recovery. So the injured employee might be in a very vulnerable state, and they might be scared or upset about the symptoms that they have and what is going to happen to them in the future and what this means to them and their job. So all that anxiety just makes the situation a lot worse for them. Doing one thing is reducing the stigma in the workplace surrounding concussions can help this very much. And knowing that you're going to work and people are reassuring you is very important to them. Again, it reduces that isolation and all the anxiety that revolves around that. So when to return to work? When workers with symptoms that are present but do not change with an increase in activity, you may have to have supervision for them or modified hours. Working from home, again, is a good one because then they can have their own place to rest if they need to. They can reduce the noise better than in a lot of noisy workplaces. Or a modified workload or reassignment of positions. So dealing with the underreporting of concussions, something that is very close to me and what I looked at specifically with my research. So although education is important, the ambiguity in concussion definitions, the intentional underreporting contribute to the underreporting of concussions throughout all sports and workplaces. So although it's caused by a physical trauma, concussions are an invisible injury that leaves little to no visible physical evidence. So the assessment is not as simple as testing for swelling or pain or a strength test, but you have to basically scan through all these symptoms and screen people to see if they have any of these, and if they do, then it could be a concussion. So the self-evaluation can be very difficult. So to you, what does it mean to be feeling like you're in a fog? Because that is one of the symptoms that you're supposed to look for. And we actually asked students at Western this, and there's very different responses in each group to see what does it mean to you to feel like you're in a fog. So even the definitions of what you're supposed to be looking for, the symptoms, can be very unclear for people. Okay, and it still can be knowledge. Even with today's awareness, there's a lot of people who are unaware of all the things that can be involved with concussions. In a survey among ED patients, 88% of the respondents who experienced concussion injuries reported that they didn't recognize that they had suffered a concussion. Okay, and it's very similar when you look at sports studies as well. So why are these concussion symptoms being underreported? And it's important to think for yourself, if I had a concussion at work, or if I say I got a headache, a slight headache at work, what would I think about it? Would I think it's a concussion? And would I report it? And why wouldn't I? And because it's very individualized reasons. For my research, I did one-on-one interviews with CFL players and discussed reasons why they weren't reporting these concussions. And it varied a lot, and it's very individualized. So one thing that I talked about, it can be knowledge about concussions. You might just not know that you didn't get hit in the head, so you think that you didn't have a concussion. But really, you could still have a concussion from getting hit in the body. The assumptions about how concussions will affect them. So a lot of people think that when I was a kid, I had a concussion, and I felt like I was in a fog the whole time. But this time when I got hit at work, or I fell off something, or I got in a motor accident, I just had a really bad headache, so I don't feel like I had a concussion. Well, future concussions can be a lot different than previous concussions in your life. And there's no concussion that is going to happen the same way every single time. So it's important to always keep monitoring and always keep screening for all these different symptoms that can happen. It can affect your social identity. People might not, they don't want to feel isolated at work. They don't want to feel like they're injury prone, or they are milking it because they can't show that the injury actually happened. So they might be scared about their social identity and underreport it for those reasons. Or they may have a history of concussions and don't want to report that they had another one, as it could lead to future complications. Job security is a very big one, especially like I was talking about, if you own your own business and you don't have the time to take off work and you can't do that and you have to work through it. So fear of job loss and job security can be a big reason why people underreport their concussions. And in most sports studies that they looked at, it's around 50% that people will underreport these concussions. So I assume now when you bring in the factor of that this is people's careers, this is their jobs, this is what's keeping them and their family supported, there's going to be a lot more reasons to underreport, so financially. So again, the assessment of the event that caused the concussion can also factor into whether somebody reports their concussion or not. And like I was talking about before, you're not in a good state to be assessing this risk. So it's important to have a second party assess you. And there's also the uncertainty of the diagnosis and uncertainty of the risk to continue. If you think that you've only had a minor concussion and maybe you have a light headache and you think, well, I can work through this. So they're really gambling and saying, I'm uncertain that this is going to be a problem for me, so I'm going to gamble and I'm going to continue to work. But as we talked about earlier with second impact syndrome, that can be a very big problem, and you could be causing yourself, you can be putting yourself at a very big risk by coming back. Also, if the symptoms are not drastic enough, it's not going to alert people. Painkillers were also talked about as they may mask symptoms. So you may be taking painkillers for your lower back, and then you get in an accident, and now these painkillers are masking some of the symptoms that you might be looking for. There's also external pressures to continue work, and sometimes these can be generated internally, thinking people want me to come back to work, or I fear that they don't believe me, thinking that there's external pressures. Or maybe there is external pressures such as deadlines or work goals that you're working towards, and you don't want to take this time off right now to deal with this injury. There's also stigma about concussions in the workplace, depending on what workplace you're in. And there's also a normalization of concussion symptoms. People, and this is more in sports, that they would get used to the fact that they play a football game and they'll have a slight headache after. And it just almost comes with the territory. Also, with underreporting, there could be underrecording of concussions. If you're only looking at the ones that get brought up at the workplace or in the emergency room, and you're not factoring all these in, even with all these statistics about how much it's increasing, it's probably even more if you factor in all the different recording methods that could be possible. And it's always important to report these right away, as again, I talked about delayed symptoms. So who should be helping on the front line with concussions? It should be a discussion. Obviously, doctors should be the number one, especially when it comes to recovery and what to do and guiding somebody and surveilling somebody. But physiotherapists are also involved. Ergonomists could be involved, especially with prevention. The Joint Health and Safety Committees should be involved with creating guidelines and prevention guidelines, and also monitoring techniques for anybody that's susceptible to a concussion or that looks like they've had one. And workers should be involved as well. And this is talked about in sports, that the other players should be monitoring each other too, because they're the ones that are closest to these people. You can notice emotional changes in people. You can tell when somebody's off or if they've fallen and they're not quite working the same. It's important to help each other and for everyone to be aware of all these the symptoms that could come up. And this is being shown now. Teachers and coaches are being expected to be knowledgeable about concussions in schools and in sports. So there's a number of different validated tools, and I won't go through all these. The number one that I came across that gets used in the workplace is the Rivermead Post-Concussion Symptoms Questionnaire. And all these are just different screening methods to screen for all these different symptoms. So this is an example of the Rivermead Post-Concussion Questionnaire. So you go through and you discuss the different symptoms that you might have on a scale and how much they're changing week to week or day to day. So I provided a bunch of helpful links and resources, and hopefully you have access to this PDF. There's a lot out there. There's a lot of guidelines, and concussions is a very hot topic right now. So there's a lot of prevention techniques, and things are evolving month to month, especially with the recovery. But there's a lot of good guidelines out there, and I wanted to put everyone that I could find in a file for you guys. But definitely go through all these, and the more that you know and the more each worker knows, the better the awareness and the better the prevention. So if you have any questions, you can contact me at OCAL. Yeah.
We got about 5 minutes to go.
Okay. Okay.
Great. I have some online questions for you, Daryl. Tim, we were going to circle back to your question for Katie, but I think she's answered you via email. So your new question is, if a person experiences 2+ concussive occurrences and there are lingering symptoms experiences years later, are they essentially permanent, or is there a chance to improve brain function?
I think that there's a chance to improve. From what I've seen, you can definitely fully recover from a concussion. Depending on some of those things like CTE, there could be future problems that arise later, but definitely full recovery happens to most.
And thank you. I have a comment from a return to work specialist with the WSIB, just contributing that she sees the highest rate of concussions from schools with teachers, ECEs, and EAs from falls, physical aggression from students, and being hit by a ball.
Okay.
So that's the reportable. So just contributing that.
Okay.
We have a hand, maybe Vani, if you want to get to the audience, and I will see if there are any further questions online.
Thanks for that. That was very interesting. I appreciate it. Thank you.
Thanks.
Just more of a comment than a question. I've dealt with this for the personal friend as well as in the work that I do in our disability management program. I think a comment is certainly to help folks. Concussions are significant in terms of when people go off work, right? So it's a matter of the sequelae of depression, anxiety, role change, not only at work, but also at home. Now you can't do all the things I used to do at home, and my roles change, and I become isolated. I think a comment here is just, keeping, as supervisors and employers, just keep in touch with your folks who go off, just to help them, to keep them connected, because I know it's a difficult time of getting a concussion when we're mentally struggling with our cognitive ability, and then also keeping in mind to remind people that there are other services like our EAP and other things to help with things like depression, anxiety, and other things that are sequels of this injury. So it's important to keep reminding them of other resources there to help them from the psychological, social perspective in coping with this kind of illness and injury.
Oh, that's a very good point. Remaining positive for the people that are isolated and can't even come into work, for sure. It's a good point.